Okay, go ahead.
Okay. So this is the Coreflex Contender elbow. So we are going to fit her left arm. This is side specific, but one size fits most. So when you pull it out of the bag, it will be in the unlock position. To lock it, you use this yellow lever to either unlock or lock. So the first thing I will want to do is, right now that the zip lock is in the unlock position, is size this to the patient's arm. And what I will want to do is slide this piece all the way down to the wrist so this brace stays in place and does not slide out of position. So once I do that, I will have her slide her wrist through this strap. This is the only cuff that does not have a buckle, so you will have to tighten this. So I will kind of rest that right there on the elbow. Sometimes I like to lock it when I fit, just it's a little easier there. And then on this strap, I will find the Velcro and just kind of tighten that circumference. This cuff also is malleable, so I can kind of bend this to the patient's wrist, so that helps with the fit. And then I just tighten this right here. All of the straps have alligator tabs on the Velcro, so if I need to trim, shorten the strap, and then reattach, I can do that. For demo purposes, I'll just kind of show you here. So make that nice and snug. Again, this cuff is malleable to fit around that wrist. We'll just overlap it here. So that's the position there for that cuff. And then really, I just kind of work my way up on the cuffs. Again, this one is also adjustable, so I can kind of form this around the patient's forearm. I will also lock these tabs so they don't move. I call this like a ski buckle. So this one, again, you can size it. If you need to trim it as well, you can. This comes around, and I'll just show you here on the video. The tooth here kind of goes in. You'll hear click, and now it's locked. And then same thing. We can always trim these, but I'll just tighten it around and attach it up back here on the cuff. On this bicep, or the upper humeral portion, you can also raise these a little bit, which probably right there at the top of that humerus looks pretty good there. So on the top, you do have the ability to remove the interior cuff. You might want to do that if there's a bandage or dressing, incision, depending on the injury, to allow a little more space to the patient in flexion. To do that, there are two little gray teeth on this top cuff. If I push that down, well, first one, unlock it. If I push that down, this will actually slide off. Same thing here. Now I can just take this interior cuff off of the brace completely and then reattach the right here. You might not have to do that, but it is a nice feature to have, again, to allow a little more flexion. There we go. The top cuff, again, is malleable as well, so I would want to fit that so that there's contact around on the patient on the whole side there, and then lock that in. Again, if you need to, you can adjust, tighten it up, and adjust there. So right now it is locked. If she wanted to, if the provider wanted to set certain flexion and extension, you have the ability with these push tabs. Right now she's at a 0 extension, so she would have full extension. She's at 80 flexion, so it would stop at 80. So we have the ability to, again, to adjust where we want it and then set it. And then lock it. So to take the brace on and off, all we have to do now is just clip or push down on the buckle right there, slide it out. On the distal strap here, I can usually just keep this, maybe loosen it up a little bit, but I usually keep that on, reattach the Velcro, and then I just slide it off the patient. So let me show you real quick if I wanted to put that piece back on. Again, these two teeth here, push those down, slide that off, reattach this piece, and then lock it, and then simply put this piece back on. It helps to push this down again when you go to put it on, reattach, and then lock it. So that is the Contender elbow.